Hey y'all, it's Dave and Annie here, and we're joined by Marilyn Sullivan from Bi-State Primary Care Association. She navigates for a living, and if you don't know what that means, if you've heard of the
GPS?
No, well, yeah, in a way for the healthcare society that we've got going on now, the ACA. You can answer some questions so people can understand how it works and what a navigator does.
So I think a navigator is a very apropos name for the assisters in New Hampshire who help people manage their way through the Affordable Care Act and the New Hampshire Health Insurance Marketplace to help find health insurance for themselves.
So if somebody doesn't have insurance right now, they would contact you, for instance, and you would do an interview with them and then see how they fit into the ACA's pattern.
Absolutely. So that is a very important message that I know a lot of people have questions about whether health insurance is appropriate for them or not, and we want them to give us a call. We can help them determine how the policies affect them and how the rules affect them. Also, what their premium tax credit will be, which will lower their costs, their monthly payment. Exactly. There are multiple ways for individuals to find an assistant in New Hampshire. And one of them is to go to findahealthcenter.org. But people should also know that like I say, there are multiple places. They can go to healthcare.gov, and there is a Find Health icon that people can go to, and not only will they find all the assisters there, they're affiliated with our community health centers. All of our assisters, our navigators, and certified application counselors are certified to do this, so they're all going to be listed. But also brokers, so we're all working together to get people into the right place, because there are options once we can take a look at what their needs are.
Right.
Take the worry out of it a little bit too, kind of guiding them, less stressful.
Yes, anybody knows that health insurance is just a maze of things.
Yes. So one question I have is, why should I buy insurance when I'm young and healthy?
A lot of young people think they're invincible.
Yeah.
We remember those
We've all been there.
Yeah, we've all been there. But in fact, it's pretty interesting that there was a study done a couple of years ago, and they found that those people who are between 19 and 35 are actually more accident prone than most others, and the reason for that is because they're out, they're active, right?
Yep.
Yeah. But they think that they're invincible. So if you're young and you're healthy, one of the main things that you're doing is you're setting yourself up for peace of mind and protecting your financial security.
Because that can go away with a major injury pretty quickly.
That is right.
Yep.
That is right. And there goes your financial security for a very, very long time. But aside from that, there are a lot of preventive services that are very appealing to young people. One, if they're healthy, they get their annual exam, no problem, and that's at no extra cost. But there's a lot of other preventive services that are very attractive to young people. Family planning, different counseling, there's immunizations, of course. Behavioral health, alcohol, smoking cessation, depression counseling, and so forth. So there are a lot of services that are very appropriate and very appealing to that 19 to 35 age group. Many young people, particularly college students or part-time college students, they're not working, and so they don't have a lot of income.
Right. And
in New Hampshire, we have the expanded Medicaid program. And we just slide them right there. They're eligible for expanded Medicaid, and this is a perfect place for them to get comprehensive care, and yet it's not going to have an impact on their budget, what their budget is.
And at the government side, you can also estimate how much you can get and that sort of thing too, right?
Absolutely. So a very useful tool for all consumers, and again, the navigators use that as well, is at healthcare.gov. There is a marketplace plan estimator tool, and it's you can play with it. It's not the application. The person can go in there, and they can change their income. They can change a lot of several variables that would affect the premium tax credit and ultimately the premium that they would be paying for the different plans. So that's and the other thing that's also very useful about that is that people now, they have, it's a more robust tool, and people can actually put in their physicians or their providers
Find out.
and see if they're in network. So when the answers come back to you and you can see all the different plans and what the premiums will be on the estimator tool, it will also indicate whether your provider is in that particular network. So it's taking a lot of the guesswork and it's making it a much better experience for people.
Yeah, I didn't have insurance a few years back for 2 months, and then when I went to file my taxes, I had to pay the penalty for
Right.
not having any health insurance.
Right.
So if that's not incentive enough, really, like,
You know, that is, you actually
have
bring
to.
up a very good
Yeah.
point for this year. So, so we know for the past couple of years, the penalty is $695 if you don't have health insurance. And it's prorated per month, so that is true. So a person may not have to pay the total $695, but basically, a person should be aware of that. But this year, because of the way the premium tax credit has been calculated, when people apply, that's why they need to get the questions asked and answered.
Mhm.
When people go and they put in their income and that new premium tax credit is applied, many times a plan at the lowest level, a bronze plan we're talking about now, would cost quite a bit less than the penalty. So in other words, a person might be paying, a couple $100 a year for a basic bronze plan that's going to do the job and just cover that, especially if they're young and healthy.
Right.
Okay? Yes, with a high deductible, we know that. But somebody who's young and healthy, who's not going to be using the services very often, it doesn't make any difference what the deductible is.
Right.
But you do want to make, we have a out-of-pocket limit, and that protects somebody's financial security. But many times, people are finding plans at that low level that are quite a bit less than the penalty.
Yeah.
So why not,
Be covered,
be covered?
not pay the penalty, which is his money going away.
Exactly, so that you can stay well with your preventive services, annual exams, and have that there for you if you break your arm or you have an infection or you have a weak cold or something, you may have antibiotics.
You get the idea that she knows what she's talking about.
Yeah.
Marilyn Sullivan from the Bi-State Primary Care Association, thank you for your expertise and answering our questions.
So much good information. Thank you so
Thank you so
much.
much.